In this video, I want to talk about something very important for anyone dealing with adrenal fatigue and burnout. The top supplements you should avoid when trying to heal your adrenals. Even though supplementing can be incredibly beneficial when done right, these products can actually hinder your recovery and make symptoms worse. Let's get right into it. The first type of product you should avoid are stimulating supplements that don't rebuild your adrenal glands. When we're talking about adrenal fatigue, we mean a chronic underactivity of the adrenal glands. Since the adrenals are critical for energy production, a chronic underactivity will lead to a lack of energy and a lack of vitality. Now, stimulants obviously work against this, but there are two types of stimulants that you need to be aware of. Those that rebuild adrenal function and those that just mask fatigue. The first group includes certain vitamins and minerals that support adrenal health. For example, vitamin C, E, certain B vitamins, and minerals like sodium and potassium, as well as sodium and potassium cofactors that support their retention in the body. I explain the role these nutrients play in your adrenal health in more detail in my other videos that I will link. The second group includes supplements that just mask fatigue without doing anything for your adrenal health. Caffeine supplements are probably at the top of that list. Caffeine definitely gets you going for a while, but not only do you build up a tolerance to it, but it also whips the adrenals even more. That's because caffeine temporarily boosts cortisol and adrenaline, which are two hormones that your adrenal glands release, but eventually this constant stimulation will have you crash. Remember, your adrenals need rest and nourishment, not constant stimulation. Other products like green tea extract also have caffeine, but it's slightly better because it also has theanine, which is a calming amino acid. I would still do my best to limit these types of stimulants if you're trying to rebuild your adrenal glands. Also, a good alternative to coffee in the morning is the adrenal cocktail, which I also explain in a different video. The next group of supplements you want to be very careful with are copper and iron supplements. Both are among the most misunderstood minerals out there. What you have to understand is that copper and iron have a duality to them. When they're bioavailable and your body can transport them around, they're good for your health. But when they're in excess and biounavailable, so they just sit in your tissue and create inflammation, they're detrimental to your health. Unfortunately, nowadays, a lot of people have excess biounavailable copper and biounavailable iron in their tissue. The terms for these conditions are copper and iron toxicity or copper and iron overload. Especially copper can be problematic for your adrenal health because it converts dopamine to adrenaline, which again constantly whips your adrenal glands and triggers your sympathetic nervous system. So unless the copper in your body is balanced with a calming mineral like zinc, for example, you can run into things like anxiety, insomnia, fatigue, and more. In fact, studies have shown that people with major depressive disorder have abnormal copper levels and a higher than normal copper-zinc ratio. Basically, copper-dominant bodies always push the adrenaline neurotransmitter pathway, which makes it more difficult for them to fully relax. Iron overload is not as problematic when it comes to your mental health because it's not as involved in your adrenaline production, but many people still have too much biounavailable iron in their tissue, but still think they need to supplement because their blood levels are low. But this is usually a bioavailability issue. You don't need more iron, you just need to support your body in getting that iron out of your tissue, making it bioavailable again, and for it to be able to transport the iron around again, so it can finally eliminate the excess. Now, of course, there are always exceptions, which is why proper testing is so important. But most practitioners still link fatigue to low iron levels and often prescribe iron supplements without checking if they're even needed, which in the long run can make iron overload worse. And the last thing you want to avoid, or at least be super careful with, are vitamin superdosing protocols. There are many of these out there, and especially vitamin C and vitamin D superdosing protocols come to mind. These protocols often work for a while and the person feels better until they suddenly crash and feel worse. This is usually due to unintended nutrient interactions and possible nutrient depletion that you caused with the superdosing. For example, like I mentioned earlier, vitamin C is necessary for adrenal function and helps with adrenal recovery. But this applies to normal doses only, so maybe several hundred milligrams per day or even up to 1,000 or 2,000 milligrams for a few days when you're acutely sick. but taking very high doses above that every day, like some protocols tell you to, will stress the adrenals, spike sodium, and interfere with other processes like ceruloplasmin production. Similarly, very high doses of vitamin D can deplete your magnesium and potassium, both of which are already low in people with adrenal fatigue. I know a lot of people online swear by high-dose vitamin C or high-dose vitamin D, and of course, dosing and tolerance are always individual. Just be aware of the dangers and keep in mind that these protocols also backfire for a lot of people. Basically, the more you superdose one nutrient, the more you run the risk of depleting or unbalancing another. Great. To wrap up this video, remember that healing from adrenal fatigue requires a careful and individualized approach. While the right supplements will support your recovery, the wrong ones can slow it down. So always make sure to look at your nutrient levels as a whole and understand the relationship between the vitamins and minerals that you take. I teach how to set up your customized diet and supplement plan step by step in my recovery program if you want to learn more. I hope you liked this video, and I will see you in the next one.